Well, good evening, everyone. Thank you for joining us this evening. My name is David Lawson. I'm a Vice President of Vanguard Public Affairs, and I'm joined by my colleague, Beth Bowen, also a Vice President. And we are assisting with the Town Hall uh, event this evening with Genesee Health Services. We are joined by a number of their staff to talk about the Community Mental Health Millage that is on the May 4th, 2021 ballot this year here in Genesee County. We will be joined by, let me get to the next screen, Dan Russell, who is the CEO of Genesee Health System, and then his colleagues, Jennifer McCarty, Jenny Kimmel, Carrie Chanter, Elizabeth Birch, and Katie Baxter. So first, I'd like to introduce Dan Russell to talk about what is Genesee Health System overall, and then why are we asking for a community health millage. So Dan, the floor is yours, sir.
Thank you, David. I want to welcome everybody and thank you for your time and participation tonight. Genesee Health System is the community mental health provider for Genesee County. We are a public institution and we provide a pretty wide range of behavioral health services and supports for individuals who are experiencing serious mental illness, serious emotional problems, in developmental disabilities and substance use issues. And we also provide primary care in our federally qualified health center. We are mostly a Medicaid program, and Medicaid is a great benefit if you meet the criteria to receive it. If you don't, then it's not, you get a little bit, you either get everything or nothing. And we're doing a millage because we are finding that there are lots of needs in the community that do not meet Medicaid eligibility. So people are starting to fall through the cracks. There are services that are needed that are continue to be hard to fund. This was true pre-pandemic. And what we found with the pandemic is that those needs continue to grow. And we're pretty sure, based on what our national experts say, that it's just going to continue once the pandemic settles down a little bit. People are going to be seeking services, and the need for the types of services that we're going to talk about are just going to continue to grow. So as you look at the different areas that we're seeking funding for, those are areas where Medicaid typically does not provide funding or inadequate funding. We need to work more with our law enforcement throughout the county. And unfortunately, there are examples almost daily in the paper of tragedies that have happened around the country where somebody runs into an issue with law enforcement, and it's really not a criminal issue. They're not breaking the law. They're having a mental health or what appears to be a mental health issue. And if there had been a mental health individual with law enforcement, in a lot of those instances, the tragedy probably could have been avoided. And that's what we want to prepare for in Genesee County. We want to be able to train all the law enforcement officers how to handle those situations and have staff available to either ride with them or be accessible on call to help them with those individual cases. That treats individuals more compassionately and more appropriately, and it keeps individuals out of jail and out of our emergency departments of hospitals where they don't get the appropriate treatment and they unfortunately clog up the systems. That, along with the crisis center that is also a funding area, are two areas that will certainly benefit the community by helping people get appropriate care in the appropriate setting and not clogging up the very important work that the jails and our emergency departments in our hospitals do. So as we go through this presentation, please feel free to ask questions. And you don't have to confine those to the millage. If you have other questions about mental health, we'll be happy to answer those. And if you don't get an answer today, we want you to call us or email us after the presentation at any time to get answers and get services or access to services. Our goal tonight is just to provide as much information as we can, and I hope that we leave here and nobody has an unanswered questions or there's something that you're confused about. So again, thank you very much for your participation, and I hope you enjoy your evening with us. Thank you.
Thank you, Dan. First off, we're going to be covering the 7 focus areas that make up this millage. When we started working with Dan and his colleagues at GHS several months ago, we did a deep dive of research of the other 5 counties in Michigan and the mental health services that they provide through a millage-based funding stream. Those counties are Ingham, Eaton, Jackson, Hillsdale, and Washtenaw County. So in working with Dan and his team, we've created these 7 specific focus areas. And each of our colleagues on the call tonight will be going into greater detail because they are literally the subject matter experts on these focus areas. The millage itself, the language was approved by the Genesee County Board of Commissioners back in January to place it on the May 4th ballot. The millage is going to be 0.94 mils for the next 10 years, and so would have to be renewed by the taxpayers if it's approved in May. But we really want to spend some time into the focus areas so everybody will have a deeper understanding of what's going to be funded. As Dan mentioned, if you have a question about the millage or a question about GHS specifically, please post your question in the Q&A box. And one of my colleagues will be there to answer them throughout the evening. We will also be posting all the questions and answers that we received this evening on the website, which is geneseethefuture.org. So let's get started with the first focus area.